All right, everybody, welcome back to another episode of the GSD Podcast. I am so excited about this episode today. One, because of the guest we have on, because it's such a common conversation, and you guys have such an unbelievably important role in the state of Oklahoma. We have the Commissioner of Department of Mental Health and Substance Abuse Services. I nailed it.
Did it.
On today, Commissioner Carrie Slatton-Hodges. Thank you so much for coming on the show today.
It's such a pleasure. Always a pleasure to talk about mental health and addiction services.
Absolutely. And you guys are doing such amazing things, too. I mean,
thank you.
There's just, especially coming out of the pandemic, I mean, there's just so much going on in the state that we just cannot wait to hear about.
I think that's everyone's question, you know, where is Oklahoma at whenever it comes to mental health and addiction? We hear about it every now and then, but it's not often you get to hear the person who has all the information and how we line up.
And you guys live it every single day.
Yes. Well, you know, it's interesting. If you talk in terms of the nation, Oklahoma, almost throughout its history, has had high rates of severe mental illness, high rates of addiction issues, higher rates than suicide than most states. So we have a lot of issues that we have to work really hard to overcome. But we're doing a lot of great work that I do believe will affect those items in our state. And I really feel within the next couple of years we will have some really great movement on those issues.
Why is that part of our DNA? You know, you say historically we look this way, but I also think about, and anyone who's ever suffered with trauma knows that it's always something that's a part of you. It's not something you ever really get rid of. So how do you get to a healthier place?
You know, that's a really good question, and I think you can look at it in a couple of ways. One, we also have high rates of things like diabetes and cancer and high BMIs and lung disease, so it would be really actually more surprising if we had really unhealthy bodies but super healthy minds.
Yeah.
So those are all part of one system, and so I think it is just follows in that same trajectory. And some of the same things that help us have healthy bodies also help us have healthy minds, such as, you know, really eating really great food, fresh fruits, vegetables, all those things actually have an impact on your brain. Getting out and getting exercise has an impact on your brain. So I think it's just highly correlated that until we look at overall health and wellness in our state, we're still going to lag behind.
And looking at that as one thing, right? Mm-hmm. Not as just individual pieces of, it's all one piece. Is that what you're saying?
Yes, exactly.
Wow. And this is going to come out right before the holidays, so I'm thinking about all of the pumpkin pie I'm going to be eating.
You're not talking about Thanksgiving, though, correct?
I'm not talking about occasional indulgences. Right. I'm really talking about as your overall life.
Well, don't judge me if I hold on to it for like an extra few days, because I feel like that's my one time a year. But that's mental health in a whole nother way. But you guys are really involved in more than just what's the state of the state with addiction. But we were talking earlier before we started recording about addiction in Oklahoma. So if you're ranking those priorities and what we really want to focus on and get better at, just kind of what's that top bulleted list look like?
Well, the governor has set priorities for our state, and two of our main focus points are reductions in suicide in Oklahoma and reduction in, you can look at any number of ways. It would be overall addiction. Really a good measurement of that is how many people are dying by overdose deaths. So that's a good way that we track that, but really focusing in on addiction in our state and suicide in our state.
How did we come out of the pandemic? And did you mention methamphetamine is something that you're working on?
So all states suffered during the pandemic. Everyone saw increases in anxiety and depression. I mean, I think anybody who's listening can say that their mental health has suffered during the pandemic. Just from terms of concern and worry, isolation, you could throw in employment issues, concerns about family who you can't see as often. All of those types of things added extra stress to our lives. And depending upon that level of stress and how you manage stress, that has an effect on your well-being. So definitely we had greater issues with depression, anxiety, just stress symptoms in general. we saw a tremendous increase in our calls to our crisis lines, and the number of persons coming into our hospital system and our crisis unit systems have increased dramatically during this time.
You don't always know how that's going to present itself. Like if you get someone that comes into a hospital and they're having a panic attack, I'm sure you have to really navigate that and see, okay, what symptoms are they having, and then at what point do you all become involved and intervene, and what services are there to help?
We have a really tremendous amount of services, and I think that's one of the things that is interesting. In terms of a state, we have a lot of great services. So, for example, when you talk about opiates in our state, which, as you know, was a really highly abused substance in our state, which fortunately, with the work of lots of people together, policymakers, physicians, treatment services, all working together as a state, we have dramatically lowered that. We've dramatically lowered opiate prescription drug overdose deaths in our state, and the number of prescriptions that are going out for opiates in our state. But what has happened then is there are other substances in our state that are problematic, and our number one problematic substance is methamphetamine. And it's very concerning for a number of reasons. One, at a point in time in Oklahoma, we had a real methamphetamine crisis, and we really got it under control through a lot of policy work having to do with putting pseudoephedrine behind the counter, so that homegrown, homemade methamphetamine went away. Well, that left a void that there were others that were willing to step up and fill. And now what we see is the majority of methamphetamine in our state comes in across the border from Mexico.
Right.
As we had talked about earlier, we're right here on I-35, I-40 corridor, 240 corridor. We're kind of a hub that things pass through here. And the methamphetamine that we see on the streets today, number one, is much cheaper than the homemade methamphetamine. And two, it has a deadly component to it. It's laced with fentanyl oftentimes, which causes death. In addition, one of the impacts of that, not only on the persons using methamphetamine, which can cause psychosis, paranoia, really risky behaviors, as that happens over time, people don't return to baseline again. It can really, truly damage their brain and have lifelong effects. And so what used to be considered as a mental health system is now seeing lots of people with mental health symptoms, again, the psychosis, the paranoia, that are actually a result of substance-induced psychosis. And that has been a real challenge because it not only fills up your addiction resources, it fills up your mental health resources at the same time.
So we had Secretary Tricia Everest on one of our last episodes, and this is one thing that we talked with her about is the impact that's having on the public service, the public safety.
Law enforcement primarily.
Absolutely.
And but one thing I wanted to ask you is, because you guys are either started or about to start some new services out of your agency for Oklahomans to be able to take advantage of. Can you tell us a little bit about those?
Yeah, we have some really exciting changes coming. Number one is we want to create an evidence-based, statewide, comprehensive crisis system, because what we want to do is anybody that is in need of help, we want them to be able to find that help quickly and easily.
Right.
And we have an exciting opportunity, July 1st of 2022, so it's coming up rapidly. There will be a nationwide number turned on that is 988, and that will be for psychiatric crises. This was passed in legislation on the federal level about a year and a half ago to be implemented at this point in time. So you'll be able to dial from your cell phone, from your landline, 988, and help will be right at your fingertips.
Wow.
So we are building what that will look like behind the scenes for Oklahomans this year to roll out on July 1st. And there's so many wonderful components to that. But the first element of that comprehensive system starts November 1st, and that was with the passage of Senate Bill 3, which actually pulls law enforcement out of the transport of persons with mental illness that is greater than 30 miles from where they start. So anytime law enforcement is interacting with a person with mental illness that needs to either go for an evaluation or a higher level of care, and it's greater than 30 miles, then that becomes the responsibility of the Department of Mental Health and Substance Abuse Services.
Wow. So do
And
you
that
guys
starts
have to
November
build out
1st.
like more team members to be able to do that, or how did that look?
It is a combination of things, and I
Okay.
think it's really exciting. So
Probably took a lot of collaboration and innovation to do that.
I would wholeheartedly agree.
Yeah.
I am really proud of the team that we have at the Department of Mental Health and Substance Abuse Services. I'm really proud of our partner community providers, and also, in particular, another company here in Oklahoma that has stepped up. So in some regions of the state, the same person who does your evaluations, who operates the crisis center, who does your outpatient care, is partnering with us that they will become the transport entities. And I think that's a wonderful model. In fact, that's probably best practices model.
Absolutely.
They will know and interact with anyone in their region who is in crisis from the beginning point to the end.
And again, this is statewide.
It provides a standard of care.
Yes. So that will happen in 2 provider regions that they will step up. They've got all their vehicles purchased, their staff hired, et cetera. They will be doing the transportation in their regions.
Wow.
For the majority of the rest of the state, we have partnered with a person who is a 17-year law enforcement individual who has a company that, for the most part, employs retired law enforcement and or law enforcement who are looking for additional employment opportunities. And they will then be our conduit for transport throughout the rest of the state.
Wow.
So we'll be able to kind of compare and contrast these models, really gain data and see what works best. But there are some wonderful things, regardless of who is doing it, that will come out of that. Number one is, as a person who is in need of mental health treatment, you will not have to be handcuffed and put in the back of a law enforcement vehicle in order to go to a higher level of care and receive your care. We know that that's very stigmatizing, can be very traumatic, and it will go a long way in persons viewing these illnesses like any other illnesses that don't involve a criminal aspect, but that still require you to be transported in a law enforcement vehicle. So we think that is a really, really important component of this. And the other aspect of that, I think, is that is equally important, is that law enforcement has a job to do on the streets in their community, and that really is dealing with crime. And that is not necessarily dealing with persons with mental illness. What we really want is persons who have experience and training around dealing with mental illness to be the folks that are doing this work.
How critical is this? I mean, if you were to estimate Oklahoma's population and how many people are suffering with either addiction or mental illness that would be using like a service like this, that way they know, hey, this is how many people we expect in the future, how many people we have to service. I'm sure you all are looking at it from both sides. We need the staff to be able to say this is how many we serve.
So, I mean, you can look at it from a number of ways. I can tell you last fiscal year, so here's one way we gather data. When law enforcement currently does a transport, they bill us for the mileage. So they supply to us the number of miles that they drove so that we can reimburse them for those miles. So last year, law enforcement traveled about 18,000 miles to interact with and provide persons transportation to care in Oklahoma. So that's a very large number. Now there's another component of what we're doing this year that will have an effect on the number of miles, however. We have a model that is called an urgent care. You think of a physical urgent care, you know, you can go in at 8 in the evening and get whatever needs are met. Well, we have some of these on the behavioral health side, but we're really expanding those this year. And those are places that you can go in 24/7 and receive care for your behavioral health issues that are not a hospital and not a crisis unit. So it really is, if you think of kind of outpatient services on demand, if you need medication, if you need to talk to a therapist, if you need someone to talk through whatever situation is going on. If you need a case manager to help link you with resources, all of that type of stuff. So we've had some of those in the state, but we are really expanding upon that this year.
That's cool.
And really with an overall goal that at some point in time, certainly not this year, but that every county in the state would have an urgent care.
But the expansion plan to see that happen, the vision to see that happen, the ultimate goal, like that's awesome. That's awesome to hear.
It is. We want people to be able to receive the care and treatment that they need right there
That's
in their
exactly
community.
Right. So I want to go back real quick to something you mentioned I thought was really cool. I just kind of want to expand on the 988 number. Did I say that right? So federal bill that was passed, it's coming down to the state level. Walk us through that, because what would be an example of somebody who would need to take advantage of those services?
So right now, if you have a friend that is struggling or in crisis, or a family member, or you yourself feel like you need help, oftentimes the default of what happens is 911 is called. Well, 911 was really set up to be a response to more criminal types of issues, or you see a crime committed. But since that was really one of the only known numbers, that became the default for so many things, which then in turn took law enforcement out into these scenes where people are in mental health crisis, which is not necessarily the best way for those to be handled.
Right.
So what will happen, anybody can use this number, and that will be if you want information about where I can get care and services, or I'm thinking I have an issue with this, can you help me figure out if I do or where I should go?
Right.
What is needed is what we call a warm line, where it's 2 a.m, I'm feeling really down, I want to talk to someone. They'll have a warm line component. We'll talk to you about whatever is going on to help prevent you from going into having greater needs or further crisis. All the way up to, if you truly are in crisis, there are licensed mental health professionals on the phone that will triage and talk that through.
Wow.
Oftentimes they can help develop a safety plan, get some support around you so that you can stay where you're at. We also will have the ability through this call line to book appointments for you for the same day or the next day with local providers. So kind of what happens now is someone may say, hey, there's a provider near you, I'm going to give you their phone number and their name, and you reach out and connect with them. Well, that your connection may end up putting you being able to see them a couple of weeks from now. Well, this will have the ability to go in and book for you.
There's probably also not a lot of follow through too. Whenever you call someone, it takes some courage to pick up the phone and call. So doing that a second time is like, can I do this?
And so we can oftentimes diffuse the crisis, wrap support around that person, and say, at 9 o'clock tomorrow, I have an appointment for you. This is the address. Here's who you will be seeing. Then we will follow that up with the full loop that we will call afterwards. Did you get to your appointment? Was that what you expected? Is there any other support that you need? Or follow up, we see that you didn't make your appointment. So let's talk about what needs to happen next, because by not engaging in care, we're likely to see you in that crisis again. So let me go ahead and book again. Was there a barrier with transportation that we need to solve? Any of those types of things.
That is amazing.
That follow-up.
Talking about data too, if this gives you a profile for someone and you can identify them or see how many times they've called, by the time a law enforcement moment happens, do you have that? Like, does this give you data capabilities in the future to really provide a comprehensive profile on someone in case they are ever in a dire situation?
Absolutely. That we'll have almost any piece of data that you can think of that we can obtain through this system, we will keep and we will mine. Now, it's interesting that you say that, because we already in Oklahoma have what we kind of refer to as our most in need. We have really excellent data at the department, and we know people who are going in and out of hospitals, in and out of residential substance abuse, not following up with care in the community. And so we do care management and case management around those people. But there is a group of people out there that never touch our system that are having really bad outcomes, oftentimes suicide. And so this, we think, will give us the opportunity to be able to care manage those people better. You've never gone into one of our hospitals. You've never gone to one of our crisis units, but you call this time. Now, the other aspect of this that we have the ability to do is to dispatch a mobile crisis team anywhere in the state. We're building mobile crisis teams this year all across the state. So if that's not able to be resolved over the phone, we'll disperse a mobile crisis team to come out and see you and to talk through face to face. It's a team of 2 folks that will come out, and they can transport you then to a higher level of care or to the next level of care if you need it. But sometimes that face to face engagement is really needed in order to show a person, to motivate that person into really engaging in what can help them lead a healthy life.
Yeah, you guys are doing so many cool things. So
I can't keep track. How many have we talked about now?
No, exactly. That's what's awesome about it. So real quick, tell us more about you, how long have you been with mental health? What's your background? Just so the viewers kind of know a little bit more about you.
So I started in mental health probably around 30 years ago.
Okay.
I know it's shocking.
You look great.
And it's interesting, at the time I lived in western Oklahoma, and I worked for a provider system that covered 8 counties in western Oklahoma. And I just, through the 9 years that I was with that private provider system, did most every job there was. From children's therapy, in-home family therapy, overseeing crisis services, developing programs for people. And then I ended up being the chief of operations for that entity, which by then had merged and was in Oklahoma City as well. So I moved back to Oklahoma City, where I had grown up, and continued to work there as chief of operations. And then about 15 years ago, I came to the Department of Mental Health and Substance Abuse Services. I thought, I feel like I know a lot about developing services and being out in the community, and I think it's really important to be able to look from that lens into what kinds of things can move systems forward across our state. And I was in the role of deputy commissioner up until almost 2 years ago, and then I took over the role as commissioner.
Commissioner, where are we going now, though? What's your vision cast for the future, and what would you like to see done? That it sounds like you have a few things already up and running, but do we still have room to grow?
Well, my overall goal for as long as I can remember is that in Oklahoma, if you are in need of service, that service is easily and readily available to you.
Oh, there's that mission right there. That statement's amazing.
And we're still not all the way there, but we are getting so much closer. We've made huge strides, and so until that's done, I'm not going to rest.
Well, like you said, even though there's not that facility in every county, that ultimately is your vision, that it's available to people where they're at across the state, and that's what's amazing.
Well, and the digital resource will be a whole other thing, the phone bank. I think that's it. If you don't have a physical location, at least there's something there. But I do think about the people this will impact. So you might have a veteran or anyone with PTSD, or someone suffering a poverty situation, or someone else in crisis because of a family matter. And I think you're really speaking to them. So I always, we see these on Netflix now with disclaimers saying, if you're watching this and you're experiencing something, please reach out. It sounds like your agency is willing to accept them with open arms.
Absolutely.
Love that.
And I will say, I think there are some things that we still haven't gotten to that are incredibly important, and that is that each one of us has an important role to play. And that is with our friends and our family and people that we engage with, that when we see changes in behavior, when we see a person is withdrawing, they're not participating in activities like they used to, it is incredibly important, and I feel like our responsibility to have a dialogue with that person about how are you feeling, what is going on, are you having any thoughts that you wish you weren't here? And until that becomes common practice, we'll do that around physical health issues, but we don't do that when it comes to mental health. We're a little afraid of that. But it is really, really important because so many people who die by suicide have not reached out for help. They are having these thoughts, and they are having signs and symptoms that the only person that's going to be able to recognize that is going to be their friends and family. And then one other component that I think is incredibly important, and that is that persons who die by suicide, 85% of those have seen a medical professional within the last 30 days. And so we need all physicians in any kind of care asking about mental health issues and asking about suicide if we're going to save the lives of our brothers and sisters.
Like you said, it's all one conversation.
That's right.
It's all one conversation of not only, it's not mental health, it's not physical health, it's all one conversation. And it sounds like a lot of that is done with what you guys are doing, with just making the conversation happen. We even hear that from First Lady Sarah Stitt.
Absolutely.
Quite a bit. Do you guys get to work with her?
We do. Now, we were able to work together, and then the pandemic hit.
Right.
And she had a lot of folks at home during that. She's just an amazing person, dynamic voice around mental health, and yes, we work hand in hand around these issues.
What's fun is we had her on, I believe, our second episode of this podcast, and we had her on before we had the governor on, so we'd like to make the governor know about that. We prioritized her over him. So, but this is what she talked about, was getting the conversation going, and so anyways, it's so awesome to hear your message coincide with her message and you guys working together and all that you guys are doing. So, well, thank you again for not only what you're doing, not only coming on the podcast, but what you're doing across the state. I also have to give a shout out to one of your staff members, Heath Hayes. He's offset, but he does some awesome work for you guys over there, and very, very good partner over there.
I think all your staff, true. We talk about thinking teachers through the pandemic and nurses through the pandemic, but I've just seen a number of news reports saying that what you all do was so critically needed, and we're starting to see the data from that. You don't recognize it in the moment, but thank you to everyone who's intervened, because we would be in a very different situation if we didn't have your resources available.
I agree. We have some of the most amazing staff I've ever seen. They're so dedicated and so hardworking, and our partner providers across the state who willingly take on learning evidence-based practices and changing how they operate in order to make sure they're doing the very best work possible. They've been our partners for so long, and we're so grateful for them.
Love that. Well, I think to kind of wrap up this episode one, we want to encourage all listeners, if you are dealing with maybe a mental health issue, or you don't even know, you just have questions or anything like that, feel free to reach out to Department of Mental Health and Substance Abuse Services. They have plenty of folks who would be happy to talk with you.
Yeah, with anything from like a gambling addiction.
Absolutely.
We didn't really talk much about that, but
we'll have to have you back on. Talk more about stuff.
Or, alcohol. Really, it doesn't have to just be what we mentioned on the show.
Yeah, the entire continuum of behavioral health wellness, including addiction, mental health, etc. 1-800-273-TALK. If you or your loved one are having thoughts of harming yourself, reach out to that number, and they will help get you to the right resource.
And when did you say that 988 number goes live again?
July 1st of 2022.
July 1st, 2022. Love it. Well, Commissioner, thank you so much again for coming on the show here. Thank you for all you're doing in the state. It's an unbelievably important work and the service you guys provide for Oklahomans, so thank you very much.
Thank you.
Absolutely. Thank you. And guys, thank you so much for listening to this episode of the GSD Podcast. I guess we'll be soon with another episode coming at you. Be sure to like and share, and please continue the conversation. Continue this message of mental health and having the conversation with somebody who might be, you notice those characteristic changes, like you said, Commissioner. So, well, thank you again for tuning in, and I guess we'll see you soon on the next episode of the GSD Podcast. Thanks, guys.
Bye, everybody.
Bye-bye.